Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, we're continuing our step-by-step approach to anti-infective agents in the world of dentistry, and of course the next stop after penicillins is clindamycin. Clindamycin has had a long and somewhat checkered past in the history of dentistry as our second in-line anti-infective agent after the penicillins. We've almost exclusively used clindamycin for those patients who are penicillin allergic, but that's not always the case. Sometimes dental practitioners will use clindamycin as a first-line agent for specific types of infections, such as bone infection. Clindamycin is unique in that it can be either bactericidal or bacteriostatic, depending on the dose. For the most part, we use it in bacteriostatic doses. How does it work? It inhibits protein synthesis. So if the bacteria can't make new proteins, it can't grow. And that means what? Well, no growth, no reproduction. The bacteria sort of just stagnate. And that's good for us. Why? Because, well, what are we waiting for? Don't we want to kill the bacteria? Well, we do, but we want the immune system to kill the bacteria so it can pick out the bad guys that have been slowed down by the clindamycin, but leave alone the good guys who are there for our good. So again, we use clindamycin for the penicillin allergic patients for both prophylaxis as well as treating active infection. But about that checkered past, clindamycin has been known to cause some significant GI issues, most notably pseudomembranous colitis. Now, to be fair, almost every antibiotic can cause pseudomembranous colitis, but clindamycin seems to cause it most frequently, especially after, the first several days of therapy. What is pseudomembranous colitis exactly? Well, it's an overgrowth of an organism called Clostridium difficile. And that means what? Severe, persistent diarrhea. Your colon knows it's being invaded and sends out the emergency distress signal like, let's get rid of this stuff. And so you do get this severe, persistent diarrhea because, again, the C. diff is trying to attack your colon wall. Unfortunately, many patients who get this sort of severe, persistent diarrhea, who haven't had it in the first couple days of clindamycin therapy, don't know what it is. So they sometimes treat it with antidiarrheals thinking it was something they ate. And that's probably the worst thing that can happen because then they're just holding in that toxin. They're holding in that bacteria, even though the colon is desperately trying to get rid of it by, purging and flushing. So if your patient develops some type of persistent, severe diarrhea after several days of therapy with clindamycin, be suspicious because it could very well be C. diff-related pseudomembranous colitis and therefore should not be treated with antidiarrheals. As a matter of fact, the best course of therapy is to discontinue the clindamycin and have them contact their general practitioner. Many times we'll prescribe another antibacterial agent to destroy the C. diff if possible. Also, your patients will know they have C. diff-related diarrhea, and so will their family members, neighbors, and people living in the general vicinity. Why? Because C. diff-related diarrhea has a very characteristic odor, which is unmistakable. So I guess on that note, my friends, we'll end this edition of Fast Facts Pharmacology Edition. Tune in next time when we continue our quest for covering all of the antibacterial agents used in the practice of dentistry. Take care. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.